wash my hands. Hi, I'm Sierra. Are you Tyler Isringhouse?
Yep, that's correct.
I'll be your nurse for today. Today we're going to assess the heart and neck vessels, the respiratory system, and the peripheral circulation. So to start with, I have a few questions for you, just about current symptoms. Recently, have you had any chest pain?
No.
Okay. Any palpitations?
No.
Any dizziness?
None that I can think of.
Swollen ankles?
No.
Okay, and then for your past history for your heart, have you had any previous heart problems, such as a heart defect, a murmur, or a heart attack?
No.
Have you had any previous diagnosis of rheumatic fever, hypertension, elevated cholesterol, or diabetes?
No.
Have you had any heart surgery or cardiac balloon interventions?
Nope, none to speak of.
Okay, and then for your family history, does your family on your mother or father's side have a history of hypertension, high blood pressure?
Yes.
Which side?
Both, I think.
Okay. Does your mother, father, or your grandparents have a history of myocardial infarctions, heart attacks?
No.
What about coronary heart disease, like high cholesterol or plugging of your arteries?
No.
Okay. Any diabetes in your family?
No.
Okay. And tell me about your cigarette smoking patterns.
A cigar every now and then.
Okay. And what does every now and then mean?
Twice a year.
Okay. And tell me about your life stress.
I farm, so it's... Yeah.
Would you consider that a moderate amount of stress, or what does it cause to you?
Moderate to higher.
Okay.
Anxiety. That sort of thing.
Okay. Have you ever been prescribed any medications for that?
No, not needed.
Okay. And can you tell me about your normal diet and exercise patterns?
Diet? No. Whatever the little female companion wants to make me, and exercise patterns are pretty non-existent.
Okay, so no exercise. Would you say that how many times a week do you eat out?
All this time of year, probably about 5.
5 times a week?
Give or take, yeah.
Okay. And alcohol consumption? How many bottles of beer a day would you say, if you had to average it out?
A day? One maybe a day.
Okay. And your sleep routine. Do you have to use any extra pillows? Do you have to get up every night to urinate? Do you feel fatigued when you wake up?
No, I'm normally a pretty good sleeper.
Okay. And you don't have heart disease, so you don't use medications or treatments for that. So I'm going to say no. And do you self-monitor your blood pressure or heart rate?
No.
And do you have regular screenings for blood pressure and cholesterol? Do you have an annual doctor's checkup?
No.
No. Follow up with that. Okay, let's see. Do you have any changes in your skin color, temperature, or texture that you've noticed? Any leg pain, heaviness, aching, tightness, anything?
No.
And how about your leg veins? Have they recently bulged out or gotten rope-like that you've noticed, gotten hard feeling?
I think I'm pretty good.
Okay. Any leg sores or open wounds that won't heal?
Nope.
Any swelling in your legs or feet? I think you said no earlier. Right?
That's correct. Yeah.
And you don't have any swollen glands?
No.
Okay. Have you ever had a problem with circulation in your arms or legs, such as blood clots, ulcers, coldness, hair loss, numbness, swelling, or poor healing?
No, I'm good.
Okay, and you've never had heart surgery, so I'm going to say no for you. I asked about a few of these, but have you ever had a family history of varicose veins?
No.
And just to clarify, you said no diabetes, hypertension, heart disease, or cholesterol. Okay. And you said 1 cigar a year, no exercise. Have you ever used support hose?
Come again now?
Socks that keep the constriction going in your legs? You said you're a farmer, you're sitting a lot. You should look into those.
No taking.
Okay, so let's see, we're going to move on to your respiratory system. Have you ever had any difficulty breathing at rest, maybe while you're sleeping or walking or anything? No.
I'm pretty good.
Have you ever had chest pain associated with a cold or fever that you developed?
Nope.
And you said you're a farmer, so I'm kind of wondering, do you ever develop a cough when you're harvesting around dust?
No.
No. Have you had any private respiratory problems?
Nope. And
no thoracic surgery, chest surgery,
nope.
biopsies? And you don't have allergies?
Yep.
Have you ever had a tuberculosis skin test where they check to see if you have TB?
I don't
It's
believe
a little
so.
blood right here on your arm. No?
Maybe when I was younger, but I couldn't tell you.
Okay. Does your family have a history of lung disease?
No.
Okay, and tell me about the kind of things that you're exposed to in the environment with farming. Like chemicals,
Yeah.
smoke, dust.
Yeah, it depends on the year, but smoke, dust, chemicals, oil, machinery.
Do you use any preventative measures for the air pollutants?
Air pollutants, though. You run equipment, you run it outside. Chemicals, you use gloves.
But as far as your breathing goes, you ever wear a mask or anything?
No.
The stress that you feel, do you ever have a hard time breathing when you get very stressed out? Okay, if you could sit in this chair for me and just stay seated forward, more on the edge there. Okay, so the first thing that I'm going to do, I'm just going to put my hands on your lower ribs, and if you could breathe in, really deep breath. I'm just watching how your ribs move. Okay, breathe out. Seems like the excursion's normal, so I'm going to come around. I'm going to look at your neck. I see no JVD, and I don't see any visible pulsations, so I'm going to listen to your carotid artery and your jugular vein. Check the pressure for that. The venous pressure sounds normal, and I can hear your carotid pulse. I'm going to listen to your heart sounds, 5 different areas. Going to listen to lung sounds now, so you can take a deep breath in for me. Let it out. Deep breath again. Let it out. Deep breath in. Deep breath in, please. Let it out. Deep breath. Let it out. Deep breath. Last one. I'm going to percuss on your back here. What that means is I'm just going to tap on my finger, and if I hear a high sound, a high pitched sound, that means air. If it's a low sound, there's consolidation. So I'm just going to go in each intercostal space, and then I'm going to percuss on the bases of your lungs as well.
You do whatever you need to do.
Okay. Okay, moving around to the front. At this point, I would have had the patient put a gown on, and I would look at the sternum. I would see that that's midline. I would look at all the costal angles, and I would note them. Okay, and then I'm going to move on to, I need to feel for phrenitis. which if I felt that, you would have air trapped between underneath your skin, like if you had a punctured lung. I don't feel any.
That's good.
So next I'm going to compare your arms bilaterally. I'm noting the temperature, how your skin feels, the hair distribution. I'm going to check your capillary refill, which is just how fast your blood returns after I push down. Feel your pulses. Okay, you can relax your arms. I'm going to feel for lymph nodes here between your tricep and your bicep muscle. I don't feel them. Okay, and then I'm going to look at your chest. I would provide patient privacy and feel your inguinal lymph nodes at this point. They shouldn't be more than 1 centimeter. Move down your legs. Check for hair distribution, temperature, and skin texture. If you could roll your jeans up just a little bit for me. That's good. Just to your knees, both legs.
Pardon the whiteness.
Bilaterally, I'm looking again at distribution of everything, temperature. Can you feel me touching you?
Yeah.
I would check for edema. I don't see any. Check pulses. They're strong. Check capillary refill. Less than 2 seconds. There's a few other things I wanted to note. So I didn't see any apical pulsations when I would have been assessing underneath the gown. The shape and configuration of his thorax would have been 1 to 2 at that time when I was assessing under his gown. And that's everything, Mr. Isringhausen. So I'm going to go chart this, and I'll let the doctor know that you're ready.